Just because of an increase of blood in the area, increase in plasma itself. Now this signaling is there to basically wash out whatever happens to be in that affected area. So that's the easiest thing. Let's just wash the wound out. Let's bleed a little bit. Let's dilute what's ever here. Usually in the environment, there's bacteria. That's the body's #1 concern outside of like a physical wound that would cause excessive bleeding. It wants to flood out that irritant, whether it's a chemical irritant like poison ivy,
right,
or a bacteria, or a splinter. Wash it out. Let's get it away. Wash it away. Those chemicals continue in the blood, and that signals then the second set, a wave of cells that come in, and then they're more specific to, they are in the specific immune system, which are the antibodies. Now, in that first wave of cells, the white blood cells that are going around just checking things out, basically those are basophils. They're the ones that everyone thinks of that come along and eat stuff up. It's phagocytosis. They just absorb and surround whatever they find, whether it's a splinter or bacteria. And this is what's normally in layman's terms referred to as pus. That's the white stuff in infected pimples and the white stuff in infected wounds. Pus. This pus actually floating around in the bloodstream. But that's not the only thing they do. They also are responsible to send out the chemical signals that keep this cascade going. Because very often, before we even get into the specific immune system, that is the antibody production, the insult is taken care of. In most cases, all the little micro cuts on your body that you can't even see, or the larger ones, damage or injury, punctures, they get taken care of before even any antibodies are made, because right away the cells are looking around, and yeah, we got rid of the foreign invader, and I recognize all my friends, and so it shuts down. Now, you know, as health professionals, you've got to start thinking about that. What do you do when you go in and you tear a ligament, tear a tendon, cartilage? You go into a doctor, and they immediately want to stop the inflammation. And I've always thought that's the craziest thing we could do. Yeah, I'm all for stopping the pain a little bit. The pain is there to tell you don't use that joint. Let it alone. The inflammation, swelling, heat, that's there because your body is actually nourishing that wound, getting rid of the insult, the attacker, and it's part of the healing process. And we immediately try to get rid of that. The life cycle of these macrophages is about 4 days. So that's usually the length of time that normal swelling, normal inflammation should last if everything's working fine. About 4 days. 4 days, a week maximum. If you go longer than that, then you do have problems because now you're not in an acute inflammation function where your body took care of it, everything's fine, back to normal. Now you've entered into more of a chronic inflammation. A true chronic inflammation usually goes for weeks and months and years and even your lifetime. But I want to tell everyone here, first of all, you know, you need to let somebody have a little bit of inflammation. You need it. Your eyes get red or inflamed for a reason. You probably got some debris in your eye. You know, that would, so I see it a lot like if somebody went to a physician and their eyes are red, don't just give them some like Visine to get rid of the redness, which just shrinks the capillaries, by the way. What about looking and see if there is something in your eye, a speck of dust, or maybe you got some chemical in there. It could be pollen, could be a splinter, could be a piece of sand. Likewise, if you've got a joint that's inflamed, It's been injured. Let it take care of itself for a while. If the patient can stand it, don't even give them any type of anything for pain, because you should stay off of that joint, not use it for a while. Now, if it goes further than that, yes, you need to address it. You need to be on top of it. You need to be aware of what's going on. But I think mostly, you know, especially in sports medicine, we're just constantly reducing swelling, combination of ice packs, heat packs to get rid of the swelling, to get the use back. Now, that use is the fifth cardinal sign, and that was actually discovered or proposed by Galen around 180 AD. And he said, you know, loss of use has got to be the fifth problem here, cardinal sign. And so that's really what we are talking about here today. We have inflammation that is ongoing, and it results in loss of use, whether it's a joint, a knee, or even a tissue, an organ. And this is serious. So, you know, I wasn't thinking about inflammation a decade or so ago when I started first studying this. I was looking at carbohydrate metabolism. And I, along with other much more prominent researchers, have discovered that refined sugar is a poison, and it should be used lightly. Nothing wrong with a little bit, but it should be used lightly in moderate amounts, moderation in all things. But excessive refined sugar is recognized as a poison by your body. So we were trying to address that. Okay, how can we tell the body this isn't a poison? How can we get this carbohydrate to be processed correctly in your body? So I told everybody, don't use a lot of refined carbohydrates. But I said, hey, we have discovered this compound, Emulin, a formula of 3 molecules that will manage that carbohydrate metabolism, and your body will not recognize it as a poison. And then you won't get inflammation of your internal tissues. That was great, but it was staring us in the face. As we got more and more testimonials, people who took the product for carbohydrate management, diabetes who were trying to lower blood sugar, people that had trying to manage weight, they said, well, this is great, but my arthritis went away. My psoriasis went away. I no longer have asthma like I used to. My IBS disappeared. Well, that all meant inflammation to me, because I already knew those were inflammatory diseases. They were part of an inflammatory cascade. The simplest one that everyone is the most used to is hay fever. Mm-hmm. I mean, that's so common, we don't even think much about it anymore. Certainly, acute cases can lead to complete loss of function. People can even have trouble, you know, with even breathing, and their airways could be clogged. But a lot of people, actually more than half of the people in the United States, suffer some type of hay fever every year, often due to pollen in the spring or fall. And we give them antihistamines. Well, what does that mean, antihistamine? It's an antihistamine. Well, it's these basophils, this part of this first onslaught of the inflammatory response. Basophils are the first white blood cells that show up, and they're looking around, and they recognize that there's something here that doesn't belong to us, pollen, or any other allergen. So their job is to eat that up, but also to release histamine and heparin. Histamine causes blood vessels to dilate, and heparin causes the blood vessels to be more permeable. And we want them more permeable because the second attack, onslaught by the white blood cells, need to get actually in and out of the capillaries. And they go through these openings that have been opened up by heparin, which is there from the basophils. So hay fever is an inflammatory response, a direct inflammatory response. It's an acute response. It's due to white blood cells that have released histamine. And so we give them antihistamine because we say, well, that pollen is really not going to kill them. That allergen's not going to kill them, except, of course, in certain extreme cases. But by and large, it's not going to kill them. So we can just let them have over-the-counter histamines, and the swelling will go down, and they'll be more comfortable. And eventually the body will work out the pollen or whatever, or the pollen season will go away and they'll be fine. But it's absolutely an inflammatory response. We can go to another type of inflammatory response, like your gallbladder. If it goes into the same thing, basophils come by, and you have inflammation of the gallbladder, and if that is continuous, that will lead to cancer. It's the same system. So we've got inflammation is good for health in the short term and repair of your body. Long term, it can lead to things as serious as cancer. In the middle are all the things we also hate. Arthritis, certain types of arthritis, autoimmune deficiencies, asthma, cardiovascular diseases. So I've said often in the past, well, you know, inflammation, continuous inflammation can lead to disease. And everybody nods their head, but why is that? Well, it goes right back to those white blood cells. The body cleans out whatever was the pathogen, the insult, the irritant, whatever it was, and then the second wave of cells come in there and they start promoting repair. Collagen is synthesized and sent to the sites. New cells are produced. The cells speed up dividing. Cell cohesion factor is produced. All of these things are produced as part of that inflammatory response. It's the promoting of that. So it washes out the bad stuff and then it causes repair. If that repair does not get done, if there is a continued irritant or insult, those cells stay around. And those are those macrophages, that's the ones that are eating things up like Pac-Man. There are two types. There's an M1 and an M2. One of them keeps inflammation going, and the other one tries to inhibit inflammation. And it does that through a balance. As there's less damage, it chemically tells those cells, well, we don't need as much inflammation, and the M1s decrease, and the M2 increases. So we end up with a decrease of inflammation, and we have at the same time the cleaning up of debris, the cleaning up of that damaged tissue, the cleaning up of leftover antibodies, and the repair of tissue, new cell growth. And so there's a balance right there. And slowly it switches over to where we have less inflammation, more repair, and less cleaning up of debris. If you have a continued insult, you have a continued presence of the M1. And the M1 and the M2s battle each other. They're out of balance, and this is actually the number one reason for graft rejection, by the way. The number one reason of graft rejection. The cells just never, you just don't switch over into the M2s enough. You always have the M1s and M2s at the same time. It leads to chemical confusion. And ultimately, the body breaks down, and we have the development of these diseases, even all the way to cancer and rejection of graft tissue.
So, Dr. Joe, how does Emulin enter in with that?
Well, the Emulin promotes more of the M2.
Okay.
So the Emulin sits on top of this cascade. So whenever these macrophages show up, these basophils show up, and they don't recognize their friends, they send out a chemical that turns on tumor necrosis factor alpha. TNF alpha then sends a cascade of many other cytokines like isoleucin 8 and 5 and 6 and 2 and 4 and whatever, and they stay in balance. And chemically, you know, there's no brain thinking. This is all automatic through a chemical equation. They're watching what's happening, and as there's less cell debris, as there's less damage, and then there's less cell debris, then the M1s slow down because they're not getting the signal from the damage that they're needed, and the M2s come on. Emulin will inhibit tumor necrosis factor alpha, and then causes less of that M1 cells to be made. Now, why would you want to shut off inflammation at all? I just said it was great. You don't. You don't want to do that. But what we have in today's life, in our environment, is constant exposure to irritants and to insults. And I'll go back that the number one is refined sugar, is carbohydrates. Right. So you have continuous inflammation, low-grade continuous inflammation, and therefore you end up with continuous macrophages, excessive amounts that are continuing itself to promote that inflammation. And it's a feedback loop that gets completely out of control. Inflammation causes inflammation. You're going to get nowhere. So Emulin does not stop it entirely, but suppresses it enough that it doesn't feed back on itself. And it allows the body, if you remove the insult, it allows the body to then heal itself and get out of that inflammatory cycle, and then you don't end up with tissue breakdown, which leads to those diseases.
So long-term sugar abuse, carb abuse, and food seems to be the number one cause of most of these conditions because we're consuming them over and over and over again, and the long-term obesity.
No, that's absolutely right. And that is the problem. And it's so difficult to mess with people's diets. Very, very difficult. And so you need to counsel people to change your diet. But number two of that is we live in a world with constant insult. I mean, even though we have, EPA controls on car exhaust, it doesn't matter. There's still enough in the air that's going to constantly irritate your lungs, right. Constantly produce inflammation. There's chemicals, plastics. I've told everybody, I am not a tree hugger. If those of you that are, that's fine. I'm not a health nut. I'm just a scientist. And I can see that we have constant exposure to things that may necessarily kill us, and maybe will not necessarily lead to cancer, but they're going to lead to inflammation. Mm-hmm. The good thing is Emulin does two things. It does regulate carbohydrate metabolism, so it does get the sugar to where it needs to be. It does prevent it from being recognized as a poison, and it does therefore shut down that inflammation due to the sugar poison concept. But it also inhibits inflammation on itself and lets your body take a breather and it can there, and so you don't get, you get out of that inflammatory loop where inflammation causes more inflammation causes more inflammation. It suppresses that enough that your body can get back under control and rebalance itself. I really don't like all these cool marketing words, but it's really true here in this case that inulin will allow your body to rebalance. And this is why you guys are hearing people say, hey, I was going in for knee surgery and my doctor said I don't need it anymore. What's that all about? Right. Or somebody that says, look, my psoriasis is cleared up. That's a separate issue, but I would like to say that that inflammation came from the environment and the sugar. So the sugar can end up causing inflammation throughout the body, which can cause arthritis, but also these pollutants can also cause arthritis because they're causing it. It's everywhere. So I wonder, did that confuse people or clear anything up? I want to say, just to recap, inflammation is important. Acute inflammation is important. We ought to let it run its course. And then number two, chronic inflammation is caused by refined sugar and is caused by environmental pollutants. And a pollutant is just something that doesn't belong there. And that causes chronic inflammation, and that leads eventually to tissue breakdown. Fortunately, and I will say fortunately because I did not start out by trying to do anything with inflammation. It just threw itself in my face saying, man, this is really an anti-inflammation vitamin. And I tell everyone, inulin is a vitamin. It's what we need and have always needed, even before there was pollution, before there was refined sugar. We needed this to dampen the inflammatory response. It gets out of control without inulin. Therefore, everyone needs to take it. I just had a question 2 days ago. I have a 2-year-old daughter. Should they take inulin? Yes, absolutely. Because at 2 years old, thousands of years ago, she would have been eating the things that had inulin compounds in them by 2 years old. So if they're old enough to eat solid foods, they need to be taking inulin. Okay, think of a question.
I noticed that there was at the expo a lot of products, and I just recently got hit up with a company that is coming out with a new anti-inflammatory full of quercetin. So yeah. There's a lot of products using like quercetin, but no one's even coming close to, they're recognizing the importance of quercetin, but of what we have, the combination is so powerful.
Well, quercetin is certainly an anti-inflammatory. It's most bioflavonoids are. They have a real similar structure. There are 2 phenolic rings with a lot of hydroxyl units all over them. The ones that we work with have a specific set of hydroxyl units. There are 3 of them together at this one location that do all the good stuff. Quercetin is a great molecule, but you know, you'll find if you talk to any of those people, they don't know what the heck they've got. They don't know what quercetin even does. And quercetin does reduce inflammation. It also works like testosterone, by the way, and if you take enough of it, it'll actually get you angry. It'll make you have anger as part of the fight or flight syndrome. And so we have a very low level of quercetin. We have the amount that we know will not act like testosterone. We don't want that. We don't want that. Right. So we use just enough. Quercetin has two effects in inulin. One of them is it's an anti-inflammation, and the other one is it causes fat, triglycerides, and glucose to leak out of fat tissue. And so it promotes, ends up along with myricetin, it ends up promoting muscle development and reduction in adipose tissue. But, you know, I think that inflammation is going to be a buzzword here in the next few years.
Yep.
We're years ahead of them. Years.
I've got a comment to make, Joe. Yeah, I've got a comment to make. You were talking about inflammation and injuries to the body. And back last fall, I took a tumble, tripped on a nut walking down the street and crashed like a sack of potatoes. And what happened is about 2 days later, I was back walking 4 miles. And now because of the Emulin, the sugar's being controlled, which means the inflammation is being controlled, which means the repair cycle is going to be much, much quicker from what I'm hearing you say because of the restoration of the M2. So I think that may be true.
Yes, that's exactly right. The repair cycle is actually what you should experience normally. So a normal person, let's say what does normal mean? I don't know what normal means. Let's say an average person who appears in good health. They present themselves in good health, and they've got a sprain. And they go through the process, and in 2 weeks they're okay. That's not normal. Why does it take 2 weeks? It's because they didn't know it, but they're already under it. They're already in an inflammatory situation. They're in chronic inflammation because they live in this world. They are exposed to these pollutants. They are exposed to refined sugar, and their inflammatory system is already running, and their body's already hurting itself, and it's feeding inflammation. And then they get really hurt, and it goes into an acute phase where you have a flood of plasma and white blood cells, and it goes to what we just talked about. But it takes longer because there's still that background inflammation, and they're in that feedback cycle, and it takes longer to get back to where they were. And when they finally get back to where they think they're healthy again, they're still in low-grade chronic inflammation. So if you were in a pure environment and eating properly, I'm just going to say 10,000 years ago because that's the onset of modern agriculture, but any time before that, and you got hurt and you were eating the proper things and you had Emulin-like compounds in your diet, the response would have been what you found out. It would have been in just a couple of days. That's what real normal is, but we're not ever going to see that unless everybody's on Emulin. So you have that vitamin, Emulin, which is there to regulate not only carbohydrate metabolism, but it also is regulating your inflammatory responses, the cytokine pathways. It's keeping them in check, ready to go, but not yet turned on. And when they do come on, it's managed and not just the gate busted open in a wild free-for-all. So we never really see healthy people. We think we're healthy. You know, a lot of people that report back they took Emulin and they said, oh, I didn't see any change in me. And they quit. And then they say, wow, I didn't know what it was doing for me. I don't feel good anymore. So they forgot how bad they used to feel. They're always a little sleepy. They're always a little tired. You know, they're always in a little poor condition. They always have a little bit of fog in their brain. Take Emulin, what you should, and then you'll be healthy. That's what real health is. I can't get this word out enough to people. Take Emulin. And they say, well, you know, I didn't seem to do any better. I said, well, you just ought to know, you ought to think about how it would be without Emulin. You'd be much worse, much worse. Everybody needs Emulin. everybody.
So Emulin is really breaking down the barriers that allow the body to create the homeostasis that we all should be in.
Yeah, you could think of it as breaking down a barrier, something to overcome. It gets rid of that feedback loop of inflammation that causes more inflammation. And it's the same way Emulin also helps other systems very similar to that, like the firing the nerves across the synapses.
Right.
We have a lot of diseases that the firing gets out of control, and it feeds on itself, and the signal gets complete. It's a chemical signal, so a lot of people don't recognize that it's electric signal within the nerve, but between the nerves, the dendrites, it's a chemical signal that goes across there, and that chemical can build up and cause the synapse to not be able to pass the signal. And also, therefore, some people report, hey, I'm much better with Parkinson's even. I don't want to go that far. That's a whole nother lifetime. But
Yeah.
I've seen the results.
Well, we look at what is coming in the near future here is the brain formula and helping support brain inflammation.
Yes, that's right. We've got a lot of stuff in the stable here. We're going to roll them out in a methodical fashion.
Mm-hmm.
But it's basically the same concept, but using the same family of flavonoids. We choose ones that cross the blood-brain barrier. And, I want to commend you for, in our discussion, you gave me an idea of how to change that formula already, if you remember that.
Yep,
but it's the same concept. Inflammation, especially when you're talking about it coming from pollutants and sugars, things from the environment, that every cell is inflamed. Every cell gets inflamed. And, I even wonder, when we talk about a normal white blood count, I wonder what would be the white blood count of somebody 20,000 years ago? I bet it would be lower.
Oh, yes.
I think we probably have a elevated white blood count because we're constantly under an inflammatory attack, and we now just say, oh, that's average, that's normal. It's not. It's probably not. So you have the same problems in the brain. You can have them in any organ of the body, any tissue, any cell. But we have formulated now a recipe, if you will, that will specifically focus itself on the brain. And this ought to tremendously help many types of cognitive issues. And we are putting that in, I think it will be available in a supplement as well as a shake.
Okay.
And the timing will have to be when iGalen's system is ready for it, because I think we're ready to go on that one. Mm-hmm. We're also working on a type of protein bar and a type of meal replacement shake. It's not going to be 100% meal replacement because it's not going to have all the calories in it.
Mm-hmm.
Because already people get too many calories. But it was going to be a way to have Emulin. And other than taking capsules, a lot of people don't like. I don't like to take capsules. Actually, when I'm able to do it, I make myself a type of shake. I use almond milk or reduced lactose milk, and throw a banana in there, a few vitamins and things that I think that are healthy specifically for me at my age. And that's where I throw my couple of capsules of Emulin in and make that a shake up, because I don't like to take capsules. It just...
Right. So it doesn't matter. It doesn't matter, Joe. It doesn't matter when you take it. You can take it with food. I have questions like this coming up all the time. I tell them just get it in, take it with food, before food, after food?
Yeah, that's true. The half-life is around 4 days, so you're not going to mess up by even missing a time or two, but
Yep.
you need to keep a level in your bloodstream.
Yes.
Just like you need to keep vitamin C is real similar. Vitamin C is a half-life for around 2 days, but you need to get a vitamin C every day. Make sure that you have enough for when your body needs it, which is all the time. And just like that's the same with inulin. You need to take it every day, but you could take it all at once, or just because it might help your memory, you could take it with meals. There have been very limited reports of people that it didn't sit well with their esophagus. I don't know how that the capsule would have to dissolve in their esophagus, but maybe they've got those problems. Then take it with food, certainly, and just help it push through. So, but it's not necessary. You can take them all at one time. You could even, the problem with taking, like skipping every other day and taking double amounts, is that you would flood your blood system, and as soon as you would saturate it real easily, and then you'd waste it because you would lose it through the urine. You can't overdose on this. You'll just knock it out right through the urine, or it'll migrate to the skin. So it's easy, just routinely. Take it once a day, or take it twice a day, or however you like to do it, with or without food.
Okay.
But if you do say take it with food, you'll be solving all the issues at one time.
Okay. I did notice that I had a friend of mine that has had knee problems for 20 years. He's a contractor, pool contractor. And he was taking 2, and then I had him increase it to 4. And within a couple days, his pain was gone. And now we titrated down to 2, and he's doing fine.
Yeah, sometimes the bioavailability of some individuals is low. It's just the way we're all, each of us put together. You know, it's like any other thing you take. Some people don't absorb one thing as well as another, and I do the same thing. If you're having trouble, don't stop, but at least double up for a few days, a week or so, and see what happens. You can always cut back, and then usually once you can knock down that initial inflammation, then you won't need as much.
Right, right. Very good. Anyone else?
Dr. Nelson, I just put a question in the corner there. I have a distributor who has a customer who wants to take the product. Did you ask for questions?
Yes, Beverly.
Okay. But they're both fearful, and they won't go in my opinion, so I have to ask Dr. Ahrens. The lady has a left ventricular diastolic dysfunction. I put it in the group chat if you're able to see that, which may be caused by systemic hypertension. And she has stiffening of the heart muscle, which means her heart does not pump fast enough to circulate the body through the body, so the blood backs up in the lungs, and that gives her trouble breathing, and she retains fluid around her heart, hands, lungs, and stomach. And it seems that when there's low pressure weather coming, which we've had a lot of these days, it gets worse, and her breathing is affected, and she loses her voice and gets very weak and tired. And she also has a sodium problem, which would account for some of the weakness. But anyway, she's allowed only 1,000 milligrams of salt a day, and that's her medication. Do you see it there? She's just on the water pill, and the other pill is for, the other medication is, I looked it up, and it gives all the reasons why she shouldn't take it, but it's a ACE inhibitor.
Well, there's no contraindications with inulin that we know of, except for a couple of blood thinners. And we just have to tell people that quercetin you mentioned quercetin. Quercetin does have some blood thinning capability, slightly. So if you are on a blood thinning regime, we have to say consult with your physician. But other than that, there are no known contraindications at all with any drug. And I would say that if you could knock down her inflammation, which I know she has, she's a human being living in 2018, she's got chronic inflammation.
Yep.
If you could knock that down, her body, regardless of the conditions, whether it's any type of cardio issue or a stub toe, body is going to improve on its own because you have taken away at least that insult, which is the inflammation.
Yeah.
Thank you.
Great, Beverly.
Joe, I've got a question. I've been reading some lately about plant lectins, and you would be the guy to ask. How much of a factor are they, and are there specific food groups that you would avoid because they're inflammatory?
Particular foods? Did you say particular foods?
Yes.
Yeah, absolutely. Nightshades. Now you know what? I was raised in the country, and actually I ran a farm, a ranch in southern Florida for a while, and we got rid of the nightshades because they would sure kill a cow.
Yeah.
And so everybody said, well, I'm not going to eat a nightshade. Well, let me tell you what the nightshades are. They're bell pepper, tomato, eggplant, and potato. So, you know, that's probably the number one source of carbohydrate in the United States, at least, is potatoes. And I'm sorry, they're a nightshade.
Yeah.
Just look at a potato plant growing, and it's a nightshade, and they absolutely will trigger inflammation. We even had a professor when I was getting my PhD at the University of Florida, and you know, Florida is famous for ripe tomatoes. That's where most of the ripe tomatoes come from in the U.S. So they are a treasured crop. And he was in the department that was responsible for tomato research, and he couldn't help it. He just one day came out with an article saying tomatoes are going to kill you, and they're causing all this arthritis. And they ran him out of town. I mean, I'm sorry. He was no longer welcome, but that actually is the truth. Now, I do eat tomatoes, but I'm like I said earlier, moderation. I had moderation, and I don't eat potatoes anymore, actually, but stay away from those, and you'll stay away from 70% of the foods that cause inflammation. Tomatoes, potatoes, eggplant, bell pepper. I'm sorry, I had to say it.
Great.
You asked.
That's fine. Happy to hear it. What about legumes?
Legumes, by most part, they are okay because they also have tremendous nutrients in them. There's some that I do avoid, not just legumes, but it just reminds me, I avoid lentils in particular, and you also need to stay away from soybean products. Soybeans in particular have an anti-nutrient in them that actually damage your body.
Mm-hmm.
And you can't get rid of it by any type of processing. I know a lot of vegans don't want to hear that, but soybeans are not a natural, they never were a natural food item. You can't eat them by themselves.
Right.
You have to process them. It's a totally artificial food. Well, not artificial, but it's not a natural food for us. It never was. So most legumes are fine. I avoid lentils and soybeans.
Thank you.
Great.
Back to the soybean for just a second. Have you heard anything about being fermented, making it okay?
No, I haven't. I
Okay.
haven't. There may be a process. I have not heard it.
Okay.
I was going to ask you in your when you're making these products to make sure soy wasn't in them, but if I could add almond, I know almond's a good product, but a lot of people tend to be allergic to almond and chocolate. To the New Future shakes and stuff, can you keep those out of it and still have a good one?
Yes, we will not have any soybean in there. Chocolate will be made available, but there also will be other flavors. I know some people have issues with chocolate, and we will avoid nuts. You know, I don't have any of those issues, but I certainly know people that can't even let an almond touch their face. They break out like poison ivy. And, you know, any of those where everybody talks about peanuts. Well, there's somebody that's allergic to something everywhere. I don't know if any of y'all caught this about 2 or 3 weeks ago. A young girl, she's allergic to water. Allergic to water. And so when she cries, the water in her tears scar her face. And they have to give her dry baths, chemical dry baths, and she blisters from water.
Oh, wow.
And apparently, you know, it's like 5 cases worldwide a year that show up like that. So we can't help but have water in it, but we will try to keep out those products that are a lot of people are sensitive to in particular. We can't do every single one because, like I just said, we have to keep. There's somebody allergic to something everywhere.
Yeah.
We'll do our best.
Thank you. That's reasonable.
Anything else? Any other questions? Dr. Gluckman, good morning.
Hi, Eileen here. Dr. Joe, I just wanted to make a comment. A couple weeks ago, you were talking about how the excess emulin comes through the skin. And I took note of that. And my son, who has significant acne along with autism, I increased his dose of Emulin E to 3 capsules a day. And within that period, his acne has cleared up greatly. It's unbelievable change.
Well, the excess, as I did say, excess migrates to the skin or is eliminated in the urine. If you take enough, it absolutely will help your skin in any skin condition, including sunburn. Interesting, very interesting that you just said that. It reminded me that the besides DNA issues where you can get cross links on DNA from the UV damage from the sun, the number one problem with getting sunburn is the production of hydrogen peroxide. And that is what does the damage to the skin more than anything else, the hydrogen peroxide production. And that is part of the inflammatory response itself. So Emulin is able to reduce the production of hydrogen peroxide in the skin, and therefore you get less damage from exposure to the sun. But, you know, you're right. Where do we draw the line? Where do we stop with this? I don't know. It can confuse people. It's a vitamin, people, and I wish that the laws were different.
Yeah.
But they're not. So we can't say, hey, this is a vitamin. What we can say is doggone good for you, from your toenails to the tip of your head. I was going to say to the tip of your hair, but I don't have any. So top of your head to your toenail and everything in between, there's something that Emulin will help. And it's basically almost something to do with the inflammatory process. And you know, acne, there's we're learning new things all the time about acne, but it's part of the inflammatory process. It's an autoimmune response. It's a basophils, and that is exactly where inulin works, at that basophilic level where they regulating the concentration of the M1 cells and the M2 cells.
Well, I have a golden retriever, and she sometimes has issues with her hips. And she was having an issue a couple weeks ago, and I said, I'm going to give her I gave her 2 or 3 Emulin, and within a couple hours, her hips was better. Put her in food, got her down her throat, and she did better.
Inflammation.
Yep.
Got a question too about overdosing, if you want to call it that, but taking more than the recommended amount and having it go through the skin. If there are, and I'm thinking a lot about, we do a lot of hydrogenated oils in our culture today, which I've been led to believe over a lot of years of reading and research that can cause a lot of sun damage as well, because people who live in countries that are more around the equator aren't eating those type of foods with all the hydrogenated oils, so they're not getting the sunburn, even with a greater sun rate or exposure than we do up in Michigan, for instance. But if we get rid of the hydrogenated oils, and I'm wondering if Emulin would help to push out or detoxify the skin.
I can't say actually if it helps push it out or detox. I haven't studied that specific mechanism. I would say, though, 2 comments about that. First of all, we can get back to inflammation. If your body is not worried about inflammation, it's going to be able to do everything else okay. So, you know, if you're sitting there and you're a machinist or a diamond producer or something, you're sitting there working, and I'm standing by you, slapping you in the face every 5 seconds, you're not going to do a real good job. And so if you can stop that inflammation and take that insult away from your body, that constant insult, your body's going to do whatever it was doing better anyhow. And secondly, about the diet of people in the tropics, you got to remember people where we came from. We came from the equator. We came from the tropics. This is why a lot of the food that's in the tropics is really good for you. And the products in Emulin are most abundant in tropical fruits and vegetables, even though there's not enough of them in there. That's where they're found the most, like a pineapple, a mango, oranges. That's where most of great southern variety of grapes that grow in the tropics. That's where most of these Emulin compounds are found naturally. We were made to eat that type of diet. Certainly we have evolved, and we eat different things, and we drink cow's milk, and we have different diets now that we can handle okay. But if you were asking me what we should eat, I say eat a tropical diet. It's not all about, so much as oils and how much fish, how much pasta, how much this and that, Mediterranean diet, all these different diets. I think it's a lot of it's got to do with what type of vitamins that we have not even recognized yet. Vitamins that are in these particular diets. And just like you said, people that are along the equator, and I mean, it's the sun difference, the power of the waves along the equator are so much different than just a couple 100 miles north or south of that. Mm-hmm. It's tremendous. Just go take a vacation to Hawaii or come here to Puerto Rico. A couple 100 miles, a tremendous difference. And we had to have protection. And I believe there are vitamins in these foods that we just don't know that they exist, that are helping us.
Dr. Jack, you had a question?
Yes, he does.
Okay.
Dr. Ahrens, my question for you is, yesterday we met a family here. We're wintering in Florida, whose daughter, 7 years old, at 7, they discovered she had type 1 diabetes. She's about 10 now. And my question, would the Emulin, I didn't want to talk to him about it till I did find out, would it be helpful with type 1 diabetes? We've had great success in our office with type 2 diabetes with the Emulin.
Our very first study was with rats, STZ-treated rat. Which, it means rats do not have any functioning pancreas. They're type 1 diabetic. And causes them to start producing insulin. So we've never done a study with type 1 humans, but the only plausible explanation is that those rats regenerated beta cells, started producing endogenous insulin. And I have given Emulin to some type 1 diabetic people, and it has improved them dramatically. But I can't just say yes because I have not done a study on type 1 diabetics. What I can say also for sure is they need it because they're humans living in 2018 on this planet, and they need to get their inflammatory system under control. And then at the very least, their body will be able to do better, type 1 or type 2 or type 3 diabetes. But I do believe you will see endogenous production of insulin.
It's great.
Awesome. Thank you.
Any other questions? Comments? Well, Dr. Joe, thank you. Been a pleasure.
You're very welcome. Maybe the next time we talk, I'll be in a better setup and have a better signal. I'm fighting AT&T every day. We'll see what happens.
Hey, it turned out pretty good. It turned out real good.
In the meantime, good health.
Yes.
We appreciate you.
Appreciate it. Thank you so much.
Thank you.